Every year, medical and health stories make some amazing headlines. Surely 2010 will be no different. And so we polled the medical community to see what advances, what trends in healthcare and medicine might make news in the year coming up. So we're joined this morning by ABC News Senior Health and Medical Editor, Dr. Richard Besser, and GMA Medical Contributor, Dr. Marie Savard is back with us here this morning as well. Good morning again to both of you. Happy New Year.
Happy New Year.
Happy New Year too.
One thing a lot of folks are going to be happy to get rid of are all the headlines about H1N1, but I'm not convinced we're done with this. Dr. Besser, are we?
Well, I think you're being not convinced is a good way to be. We've seen with previous pandemics that they come in waves. 1957 is the classic one that all of us in public health are talking about now, because it had big waves in the fall, went away, and then came back with a fury after the new year. And there were increased number of people who died, and it was very worrisome. And what people have now is the opportunity to say, okay, there's a little break in the H1N1 action. There's time now and plenty of vaccine. You can do those things that you need to do to protect yourself and your family.
So stick to all the guidelines that we've been passing along in 2009, because there's no guarantee that it won't pop back up in the spring.
Not only that, but it's flu season. And so those things, washing your hands, covering your cough, staying home when you're sick, keep your children home when they're sick. You know, if you do that, you're going to ensure that even this regular flu season is not as severe as it otherwise could be.
And no matter where you stand on healthcare debate, which was a huge story in 2009, I did want to ask you about electronic record keeping, medical records, because I know that aside from the debate, doctors are already moving in that direction. And how will that make a difference from a public health standpoint?
Well, from a public health standpoint, it will be absolutely fantastic. It will move the field of public health forward in dramatic ways. As a public health provider, it will let me know in my community, what are the biggest health problems? Are we having problems in our community with diabetes? Are we having problems with obesity? Are we having problems because the children aren't being vaccinated? That will be very useful information in terms of developing programs to address those. And as a doctor in the office, as a pediatrician, I'll be able to look across all my patients and say, which children haven't been vaccinated? And identify them and pull them in. Which children with diabetes are out of control and need to be referred to a counselor for additional group kind of work? That will, I think, just take us, so far down the road to improving the health of the entire community.
Community at large. Seems like such a no-brainer. And Dr. Marie, I know you always want to jump in on this notion of personal health. We're more and more taking control of our own health, and these records will make a difference too.
Absolutely. Personalized medicine is where we're going, and the truth is the more involved patients are in their health decisions, the better the outcomes will be. So giving patients the ability to access that medical information, their own information, which has typically been kind of kept hidden from us, is going to be so powerful. We talked about the guidelines this year for mammogram, for Pap test in the past, in 2009. We're going to see many more changes, some real sharp looks at what's going on. And it's going to boil down to, what is your personal risk? What is your family history? What are the risk factors that really matter to you? Having that information, merging it with the science, new technologies coming up, smarter, maybe digital mammograms. We have different HPV along with the Pap test. Lots of new things coming down the line. And men, PSA is an issue too. What's the history?
And so you say don't be afraid of this notion of electronic records. Actually, it helps you to take control of your own future.
Yes,
as far as your health.
Ask for that information. Don't just let it be a little black box of information that your doctors have. This is something you have a right to be involved in as well. And I think it's really important that patients know that. They need to ask for that information.
And Rich, one thing we heard from Marie there was on the mammograms, all the headlines in late 2009, the confusion. Does that sort of calm down? Do people fall into what they want to do with their own doctor as we head into 2010? Or do we start to move in that direction of those guidelines?
I think that the fallout from those mammogram guidelines is going to be very large. One of the things that you hope is practiced in medicine is treatment based on evidence. What is the best evidence for various approaches to care? And one of the fallouts from the mammogram was that they were launched in a really clumsy way. There was an engagement with the general community about those guidelines, and the interpretation, I think, went far beyond where the evidence was. And I hope that it won't set back the whole field of how do you use new scientific information to drive the best practices for everybody so that we're all getting improved care.
And you mentioned the evidence-based guidelines, the sort of stats at large, but a lot of folks, when they heard these guidelines, said, but what about me or my cousin or my aunt?
Yeah.
So that's where the frustration
How do you
came in. Did you hear that,
personalize
Dr. Marie?
That's right.
Yes, and how I care. My family history might be unique. I may not meet the guidelines, but I actually, in terms of my personal situation, what I know about myself, what my lifestyle, my choices, what I have access to. Yeah, I think personalized medicine is here to stay, and I think that's really exciting.
And one of the things both of you have said is that personal guidelines are just that, guidelines. Work with your own doctor to continue
Yes.
to sort of forge ahead. Women's health care in 2010 will still be a major newsmaker. Anything on the horizon we should know about?
I think there are. I think the hormone issue is important for women. Let's take women around menopause. The pendulum, believe it or not, is spinning back up again towards women at menopause, thinking about low-dose hormones, taking it in a safer route, maybe through the skin route. So I think we're going to get some results of some clinical trials that are going to help inform us around estrogen, but it's not going to go away. Women, spend a third of their lives in menopause, have a lot of symptoms. That issue is going to remain. And then for younger women, we now know that a lot more women are using birth control pills. We have access to those. But in the past, women would end up triggering a period every month. What's becoming much more popular, and some of the experts we talk to think this is going to be a much bigger trend, women are going to take the pill that suppresses or turns off their period altogether or for extended periods of time. Again, with health benefits and no real health concerns, although that's always a question.
A lot of women out there counting on you to stick with us here on GMA in the year ahead. And Dr. Richard Besser, you came on board in 2009. Here's to a great year ahead.
Thanks.
Welcome and Happy New Year to you both. Thanks for being here.
Great.